अस्सलामुअलैकुम, आदाब। आज मैं बीनिश काज़मी आपके साथ फिर से एक बार हाजिर हुई हूँ RNA का हेल्थ लाउंज एपिसोड लेके स्टूडियो श्रीनगर से। आज जो हमारे साथ शख्सियत वाबस्ता है उनका नाम है डॉक्टर मोहम्मद ज़फरुल्लाह, जो बेसिकली बैंगलोर इंडिया से हैं और उनने अपना MBBS जो किया था वो भी JJMC मेडिकल कॉलेज से किया था। उसके बाद उनने वो शिफ्ट हो गए यूके में, लिंकनशायर, नॉर्दर्न लिंकनशायर में गूगल NHS ट्रस्ट के साथ डायना प्रिंसेस ऑफ वेल्स हॉस्पिटल्स के साथ एसोसिएटेड हैं और एक बहुत ही मशहूर और बहुत ही काबिल इंटेंसिविस्ट हैं। आज आपका यहाँ पे आने के लिए बहुत बहुत शुक्रिया।
Thank you very much for having me, Ayesha. Islam.
The pleasure is all ours. We would want to know about the current issue that is here is corona pandemic, COVID-19. All of us are aware about what is happening, how it is happening. It is affecting so many of our relatives, close by people, in a very, very, very invasive way. But you being at the core of it, since you are into the ICU most of the time, आप बहुत एक्सट्रीम केसेस देखते हैं और जब सबकी उम्मीदें खत्म हो जाती हैं वो वाले केसेस आपके पास ICU में आते हैं। तो सर आप पहले तो ये बताइए कि ये कोरोना जो है ये हकीकत में क्या है, क्योंकि कुछ लोग कहते हैं कि ये एक फ्लू है, कुछ लोग कहते हैं कि ये सिर्फ हमारे जहन में एक चीज है कि है कुछ नहीं है, हम लोग सिर्फ एक हाइप कर लेते हैं कि हाँ मैं बहुत बीमार हूँ, बहुत बीमार हूँ, बहुत बीमार हूँ, और उसी के चलते चलते जो आप मेंटली परेशान हो जाते हैं तो यू कम टू द डिजीज। तो क्या आप वो क्लैरिफाई कर सकते हैं कि एग्जैक्टली ये वबा है क्या चीज?
I mean, to be honest, it is one of the worst pandemic of our generation. It has affected everyone in every way. It's affected the health, it's affected the emotional well-being, social well-being, it's affected the education of our children, it's affected the employment of our youth. I mean, we cannot just say that it is just a common flu and then it is a hype. It is real. We should take it carefully, and the three important thing is face, hands, and the space. You need to cover your face, clean your hands, and keep the space and prevent the spread of this virus. It has already killed many people and has affected many people. We should take it seriously and follow the government and local guidelines in prevention of this coronavirus.
When it started in a massive scale and people were falling off on the streets. There were so many people who were like, the dead bodies were lying on the streets just like that, unattended, because people did not know exactly what is happening. How is somebody just walking in, they collapse. And there were dead bodies lying around. People were scared to touch the dead. Nobody would claim their relatives also, because they were scared that maybe the cops would also have repercussions. The disease might spread through dead bodies also. So is there any certainty about it? Because since we've entered the wave 2, हम लोग दूसरी वेव में चले गए हैं, तो अभी इस पे भी एक दो तरह की राय आती है। कुछ लोग कहते हैं कि जो इनकी लाशें हैं, जो मर गए हैं बेचारे गरीब, जो इस परेशानी, इस बीमारी की हालत से छोड़ के चले गए दुनिया से, उनकी लाशों को लोग हाथ लगाने से इनकार कर रहे हैं, उनको प्लास्टिक बैग्स में जाके बंद करके डाल दिया जाता है। तो कुछ लोग हैं वो कह रहे हैं नहीं, डेड बॉडीज डू नॉट स्प्रेड डिजीज और वायरस। सो सर उसमें क्या सच्चाई है?
I mean, virus spread जो होता है, I mean, from person to person, and it also can spread by the dead bodies as well. I mean, by contact, by touching the virus. I mean, we have to follow the local guidelines in disposal of corpses and how to handle the dead bodies and how to bury the dead bodies. I mean, there should be I'm sure there should be clear guideline from the government how to handle this one. Instead of making any false claims about these dead bodies. I think it can spread, but as long as you are protecting yourself.
Yeah, the government does float different guidelines from time and again, but as a doctor, as a person who's connected to this issue at the basic level, you are in direct contact with the patients, their families, the people who recover, and they might be leading normal lifestyles. So what is your opinion about it as a researcher? I would want to know. Scientifically, does
I
it
mean,
transmit just through droplets, or is it airborne? And since we entered from wave 1 to wave 2, is there a chance that we might enter into wave 3 also?
I mean, coronavirus. Yes, we entered into the pandemic too. As we said, it is spread from aerosol and droplet infections. The airborne is still under investigation. Still, the people are talking about it. But as for time being, we should maintain 2 meters distance. And the coronavirus affect anybody, any age, and the symptoms and the severity of coronavirus varies from one person to another person, and there's only one in three patients. The positive patient can be even asymptomatic. The symptoms, even the patient who develop symptoms, they varies from the various severity. A lot of patients don't need any hospital admission. They don't need any treatment. They can stay at home and isolate themselves and maintain clean and hygiene health lifestyle, and they all get better. And few of them who don't get better, who start developing the respiratory symptoms, like if the oxygen levels stop dropping to 90 or 92%, and they need to seek the advice from the healthcare practitioners. They may need hospitalization or they may not need hospitalization. The another most important thing is stop self-medicating yourself. People, I mean, there's no treatment for this coronavirus. The most of the treatment is symptomatic. You stop using the broad spectrum antibiotics because antibiotics not going to cure the virus. Stop
Viruses.
using, yeah, and stop using the steroids non-judiciously. I mean, steroids should be used by healthcare professionals. The evidences which are there for the steroid usage is in the patients who are critically unwell, and the patients who are on oxygen, and patients who are on ventilators. There's no role of steroids in asymptomatic patient or the patient with mild symptoms. And there is no role of routine CT scanning of the chest for staging. We don't treat the patient on the CT scans routinely. So all the treatment is based on the clinical symptoms, severity of the symptoms, and what stage of the coronavirus they are.
Okay.
When
Talking about the symptoms and the stages of symptoms, like for a common person, I am not a doctor. I would not know
yeah,
exactly what I am going through. Maybe my
yeah,
symptoms are very severe to me, but since you are a health work, you're a doctor. For you, it might be just a flu. You can check it symptomatically. You might ask me a few questions, like you have fever, you have headache, you have stomach upset. People are complaining of diarrhea. People are complaining of toothache. People are complaining of different kind of fungal infections infested with on in a aggravated level. So people are giving a shape to coronavirus in a very broad spectrum on their own. So as a doctor, how would you suggest a person who cannot afford to go for a CT scan? Because uh, you know if I am rich, I might go for a CT scan just for my own satisfaction. If I'm poor, I'll die without a CT scan because I cannot afford to have a CT scan. So, as a doctor, what would you suggest a common person can identify, self diagnose that, how severe the case is? It's not a panic case, but in practicality, how severe the case is, and I should consult a healthcare worker.
yeah, that's why I said in the beginning, the pandemic. In the pandemic, we should go above the individual level. We should think about community level. We should work collectively, and we should always follow the local guidelines. If we don't have a local guidelines, we follow the WHO guidelines. The main symptoms for coronavirus, as I said, is unexplained fever for a long high fever, persistent cough, and also loss of taste and sensation. Yes, if you have these symptoms, they can be mild, they can disappear, or they can subside by themselves after a few days. And the next thing
Hmm.
is the more severe cases when you start developing the chest lung infections. If you have facility to monitor your oxygen levels, yes, do it. If the levels are dropped below 90, 92%, yes, please seek medical help because you may need some treatment or you may need some oxygen. And routine use of a CT scan has no role in the treatment of the coronavirus. The and again, the using the oxygen, I would advise you seek medical help before using the oxygen. Oxygen is You should use in a safe environment, and there's a risk for fire, and it should be clean. The oxygen humidification, the oxygen cylinders, oxygen piping should be clean. Otherwise, you end up having the secondary fungal infections or other secondary opportunistic infections.
Okay.
I mean, as
When
I
we talk
said,
about
if you're
these,
poor or rich,
uh-huh. Go
yeah,
ahead.
yes.
You go
No, I
ahead. Go
said
ahead.
about the
Go ahead.
CT scan. I don't think
Yeah.
the CT scan, you no need to worry. There's no role for routine CT scanning in coronavirus.
Okay. So that is at an advanced level wherein the doctors would say and prescribe that
If they
yes, you
want
need
to
to go
see
for a
if
CT
they
scan.
if they want advanced level, if they want to see the extent of damage to the lungs, or if they want to see is there any clots in the lungs, yes, they'll advise you to have a CT scan. But there's no need to have a routine CT scan for COVID-19.
But then, what is the basic time frame? Like for a normal flu to recover, how long does it take? And for corona infection to really show up? Because like I've seen some people who are asymptomatic and they go on and voila, one day they diagnose that they have they're COVID positive, but they've had no symptoms at all. But then there are people who are severely infected. They've got really high cough, fever, and they might have aggravated symptoms because human body take reacts more to your psychology, like how you take to your body reacts according to your mind. So how long should a person wait before getting tested?
I mean, if you have any symptoms, yes, you get tested immediately. There's
Okay,
nothing to
on
wait.
day one itself.
I mean, if you have symptoms, yes, because symptoms means you have been exposed to the COVID coronavirus either
Hmm.
5 or 10 days prior, because there is incubation period of 5 to 10 days. Then before you develop
Yeah.
symptoms, symptoms means you have COVID-19. So once you have symptoms, yeah, go and get tested yourself and self-isolate depending upon the severity of the symptoms. And if it's a very severe, seek medical attention.
Okay.
and
So
and the most
that
important
means
is don't self-medicate. Don't use the
don't
high dose of
self-medicate.
antibiotics
Okay.
like azithromycin. There's no role for these antibiotics in the viral infections.
Okay. So you're saying that antibiotics would not help because it's a viral infection, it's not a bacterial infection. That's one.
Yes, I mean
Then you
antibiotics
say
again.
that
I said, yeah,
mhm,
antibiotics again.
incubation
The
period is incubation
five to
period
ten
would be
days.
certain 5 to 10 days. So if
Yes,
you are in exposure with a positive patient, you should
yeah,
self-isolate yourself for precautions and then think about 5 days
yes,
and then get a test done to ascertain if you
yes.
really have
Yeah.
you're
If
containing
you
the
see
virus or not.
the Yeah, if you see the
Hmm.
policies were there in the before, even in the first wave, the policy was to isolate for 14 days, 10 to 14 days if you come in contact with a COVID positive patient, or if you travel from a high risk area to low risk area, you have to isolate for 2 weeks. So that is the incubation period we're looking at. If you don't develop symptoms, you pass that period and you are now COVID-19 positive, COVID-19 disease, you have the COVID-19.
Okay. And what about the vaccine efficiency? Like, how effective are the vaccines? Initially, it was like you should get a vaccine done within 12 to 16 weeks. Then they said, no, you have to get the two vaccine doses within 4 weeks, and then it's 6 weeks, and now it's like 48 days or beyond. So, how effective is the vaccine? Because I know people, we see people, they say, oh, we've already got the vaccine done. I don't need to wear a mask. So, are they not susceptible? Are they also prone, or they're being prone is lesser? So can you elaborate on that?
I mean, yes, vaccine can protect, but you still have to be careful. This is the three things you always should practice: the face, hands, and the space. And you need to wear mask. You don't want to even. You might get the infection, but it may not be very severe in your case because you're vaccinated. But you still can spread the virus to the other person. As I said, in the pandemic, we should. Work beyond the individual level. We should work collectively for the community purpose. Then only we can get rid of this pandemic.
Okay.
Vaccines, there are few vaccines available. They have various efficacies. I'm sure whatever the local government have policies regarding the vaccination, I should follow that one. Again, the duration of action between first dose and the second dose is again, it is guided by the local policies. The main purpose for the government for the vaccination is to protect the communities, not to protect the individual person. So the
Okay.
more people get vaccinated, it's better for the we can control the pandemic very quickly.
Okay. But as a
So
researcher, what would you suggest? Like, as a researcher, what is the efficacy? I mean, is it 90%?
Well, I said that the
It protected
different
90% against the issue, or further or lesser?
different the different vaccines have different efficacy. The like the Pfizer and the Moderna vaccines, which they claim they have 90% efficacy, and then the our Oxford vaccine, which is Covishield,
We
which
have
is available in
Covishield and
India.
Covaxin in India.
Covishield, yeah, which is around 60 to 70% effective. And I don't know, but I have not seen the any published papers regarding the Covaxin.
Okay.
I think it is still on the final stages of the stage 3 trial, and it's given the emergency approval for the usage in India. I'm sure it is also very effective against the virus.
Definitely. About the vaccines, also, there are two kinds of vaccines that are available in the market. One is supposed to be the clinically made, I mean, the chemical composition, and one is the actual genetic or the bacteria made vaccine that we get in the market. So some people claim that the natural vaccine, the bacteria one, is more effective or lesser effective. And, with one, you might get a fever. Some people actually get fever. Some people have no reaction to it. How far is that dependent on your immunity and your age group?
I mean, the different people react differently to the vaccines. The vaccines which we have in India is Covaxin is a killed virus vaccine, and the Covishield, which is the adeno virus they used as a base for the vaccine. And the other vaccines, I don't know whether they have Pfizer's and the Moderna, they're the mRNA vaccines. Yes, the patients react to the vaccine depending upon the immune response they generate to the vaccines. Some people have just the fever. Some people get really bad body ache. Some people don't realize that they had the vaccines. The exactly how what is the immune response we can only know by checking the antibody levels, but I don't think that is necessary. And in this scenario,
Okay.
get vaccinated and hope that it will prevent the transmission,
Okay.
because these
Another
all the
issue
vaccines are
that's
gone through the different
uh,
stages of the different trials in stage 1, stage 3, and the efficacy and safety has been studied. There's I think we should accept that one and then take the vaccine.
yeah. One more issue we face here is when we talk about kids, there's no vaccine given to any children below the age of 18. And then there is a different range of vaccines that they say, okay, 18 to 45, then it's 45 to 60, and then rest if somebody's surviving more than that. So is there a difference between the strands that are given or the quality of vaccines that's given to a different age group?
The vaccines, when the coronavirus started, the COVID, it started affecting mainly the elderly, vulnerable individuals and the patients who are high risk, like diabetic, patients with heart disease, or the
Mm.
transplant patients. The vaccines, they studied these vaccines on the adult patient. They didn't study this vaccine on the children. And also the government's main agenda was to prevent the transmission of this virus among the adult patient and the more vulnerable patients. And I'm sure in the future they study this vaccine on the kids as well. I think there is one study for the vaccine which is going on. I'm sure it's Pune or somewhere for the children under the age of 12 years. I think Pfizer is doing a study on the kids as well. I'm sure they come up
Okay.
with the vaccine for the children as well. Yes, they basically these vaccines are studied in the adults patient and high risk group. Um,
Okay. In the comorbidity patients, the ones who have lung diseases, or some people who have kidney issues or maybe liver issues, how more? I mean, what is their level of exposure, or how much they are at risk with respect to this coronavirus? And is there a different kind of a treatment that is given to them, or they should be specifically, precarious about what needs to be done and what not needs to need not be done?
the most high risk patients are the patient who had the organ transplant, who are already on
Hmm.
immunosuppressant drugs. The
Therapies.
patients with cancers, patients with diabetes and heart diseases. The main important thing for these patients is to isolate themselves. I don't know, as long as possible, because it is now everybody is going through the emotional
It's
breakdown.
difficult. Yes.
Um, yes, and if you get the infection, and please seek medical help immediately. The mortality is very high in this group of patients. The symptoms wise, the same. They say they have the same symptoms, and they get severe very quickly, and the even the secondary bacterial infection and the secondary fungal infection is more common in these patients because their immunity is already low because of these chronic illnesses, and further medications which we use to treat the COVID-19 is further decreases the immunity of
Mhm.
these patients.
Okay, when we talk about the fungal infections, they've been there with us for a long time. How does these steroids affect the fungal infection effectiveness? It has been reported that there are so many kinds of fungal infections coming up in India. So
Yeah.
people are really scared. Is that because of coronavirus, or have they been in the space, in the air, on the floor? Can you elaborate about that? How should a
the
patient be more careful about these?
the fungus lives in the environment. They are the ubiquitous. They're everywhere. I mean, if you see our bathrooms, you see black mold, which is a black fungus.
Hmm.
Candida lives in our own body. The fungal infection is not very rare. Fungal infection is very common in critical care. Even before the coronavirus, we used to have the candida infection, most common kind of infection in the critical care. The main reason for the fungal infection in these patients is because there is non-judicious use of the medications. The first most important thing is we have to maintain good personal hygiene and cleanliness of our surroundings. One. Second one
Hmm.
is we should stop medication. I've been telling this one frequently because this is a very important message. I want to pass it to the your viewers, because self-medication is not a very good thing. And the antibiotics, the people I think people using azithromycin, the people using I don't know what all these strong, the broad spectrum antibiotics. As I said, there's no role of these antibiotics. These medications can alter the balance of the human body. These we have all the good organisms, bad organisms in the body which fight against these fungal infections or the
On
other
their own.
bacterial infection. Yes, on their own. If we take these broad spectrum antibiotics, we alter this balance of the equilibrium of our system, and which gives the opportunity for these are called as opportunistic infection. These give the opportunity to do these fungal infection to invade our body. So,
Okay.
and the steroids, there is, as I said, there's no role of steroids in asymptomatic corona COVID patients. There's no role of steroids in the mild COVID patients. The steroids, the evidence, the steroids which were done, which we did the research in the recovery trial, it was done on the patients who are on oxygen, who are critically unwell, and who are on mechanical ventilation. So this is not studied on the public who are asymptomatic, who are home. And the other medications, the antivirals, so many people are using so many antivirals, the remdesivir, whatever. There's no strong evidence. I mean, if we've been advised to take this medication by a medical professional, yes, fine. There's no point in going and seeking these medications because there's no strong evidence for any of these medications. The only
Okay.
good evidence is for the steroids, and again at the different stage of the disease. And
As advised by your doctor.
yes, obviously. Because the dose of the steroids is also important, because if you use the steroids in the patient with diabetics, then you end up altering the blood sugars,
Hmm.
and the higher the blood sugars, the more the complications. So
Hmm.
this is the most important thing to prevent this fungal infections as well, and to prevent this severity of the coronavirus.
Okay. There's a question from one of the viewers. He's saying that in case there is a patient with tumor in the head and he's infected with COVID-19 with no symptoms, he's asymptomatic, but he knows for sure he has a tumor in the head, and he's
Yeah.
been denied his MRI. What should the person do in this case?
So now the tumor in the head, was it diagnosed recently or is it long standing? Depends on that, and what treatment he is having for the tumor in the head. Has he had any operation or is he on any medications? If it is not, if it is just the incidental finding in the tumor and the medical management is only observe the tumor, then I don't think if he's asymptomatic, he just need to isolate himself and have maintain a good nutrition. And if he developed severe symptoms like respiratory symptom, then seek medical advice. There's no need to, I don't know, the MRI scan of the brain he's talking about, or I mean, if it has been
MRI of
suggested
of the
by,
brain,
I mean, if it's
because he has
suggested
a
by
tumor in
the
the head.
neurosurgeons and neurologists, yes, I mean, he should go ahead and have his MRI of the brain.
Okay.
There's no
There's
harm in
another
having
question
a
from
mask.
the audience here. The person is saying, in case the person is not having any other severe morbidities or any other issues, but just has simple fungal infection, what do you suggest in that case? A
I
severe
mean,
fungal infection.
the simple fungal infection is like, the if you seen the affecting the nails, the cracking of the mouth. These are simple infections. They don't normally occur in the healthy individual. These
Mm-hmm.
infections, these fungal, as I said, these fungal infection are opportunistic infection. They invade the body only if you give them the opportunity. If you are ill, if you're recovering from any severe illness, any illness, not only the COVID, and if you're recovering from the severe illness, you're prone for fungal infection. And if you are on strong broad spectrum antibiotics, yes, you are at high risk for fungal infection. If you are a patient who are on immunosuppressant after the organ transplant, or you are in chemotherapy for the cancer, yes, you are at risk for fungal infection. But the fungal infection is very, very uncommon in normal, healthy individual.
Okay. One more question just came up from one of the audience here. He says, since people are traveling, I mean, even despite the bans, some people have to travel because of their work or some emergencies. They've had one particular vaccine in one country of origin. Like, for example, I say somebody traveling from UK. UK, you give Pfizer, right? In India, we have Covaxin and Covishield. The person takes first dose of Pfizer in UK, and now the person has traveled to India and he's due for the second dose. What would the person do in that scenario? Can they take another sort of vaccine, or they have to wait and go back and then take the original vaccine only?
Okay, the first and important thing is you travel only if it is very, very, very essential.
Right.
And don't there's no reason to travel for leisure purpose in this pandemic. Second one is there's no studies which have mixed the vaccine. I think there are some studies going on now where they are trying to use the different vaccine for the different first or second dose or even the third dose. So to that answer is I don't know, because there's no studies which have mixed the different types of vaccines in the prevention.
So we should wait for
I mean,
now. I
I think you
mean,
stick to if the government or the policies decide to give you the
mhm.
different doses, it's fine. But I don't advise you to take the decision on your own.
The government
Um,
is not with what the doctors say, because government will have their policies as per the availability. But being a researcher, being a doctor, you have more advanced information and authority on saying what would be the reaction like. I mean, if you mix two kind of variants, two kind of different vaccines, would there be a harmful reaction, or maybe it'll just cancel the effect of the first one or something like that? So that's what the audience probably wants to know.
I don't think it will cancel the effect of the vaccine, but the how what reaction what's going to happen, I cannot
So that's under
tell, because
clinical study. That's under trial.
yes, because I don't have any experience in mixing these vaccines.
Okay.
The again, I said, the as I the reason why I said is always I say is follow the public health. Like we have public health England, and they should have public health India, or the ICMR. The guideline. The reason why I emphasize on this one is there are hundreds and hundreds and thousands of researchers, thousands of doctors, but when the policies come, there's only one government for one country. So the policy comes a single policy. If we all stick to the one policy, and then it becomes very easy, rather than just giving the individual opinion. And because as I said, there's nothing right and wrong in this one, because the research which is available in COVID-19 is very, very minimum, because this is only 2 years. The disease is from 2 years. The research is going on. Yes, we should take the available evidence and then treat these patients.
Right.
Yeah, I'm sorry, I don't
Absolutely.
have the answer for the question.
That's all right. There's another person asking, this pandemic has been here for almost 2 years now, and there are clinical trials, research analysis going on and on. How far do you think is it going to stay? I mean, will we be corona free in the next, say, 1 year or 2 years, or maybe there'll be another mutant, since we had mutant two, and then people said that it is airborne, and then some people say no, it's still droplet borne, and then there is another question that comes up like, are children more susceptible to it or prone to it? Because we've been given guidelines that children should not even step out in the gardens. So, keeping them isolated for a very long time without any concrete evidence, it takes a mental toll on the parents as well as the kids also. So how far is
Um,
that true?
I mean, the first to answer the time frame for this pandemic is difficult to know. We have the only evidence from the previous pandemics, like SARS, MERS, even the Spanish flu, which Spanish flu had for 2 years. We had pandemic for 2 years. I hope these vaccines and everything will help and then help to curtail this pandemic soon. I'm also fed up. And the second one is the kids, the children. There is no everybody is, as I said, everybody is susceptible for this coronavirus. And the more the comorbidities, the chance of you getting severe infection is more. Yes, the rules is same for the children, the adults, and everybody. The clean your hands, cover your face, and 2 meter distance. Okay, and fresh air. If you are want to go in the garden, it's fine. If you are the family, yes, you can play with the family, and no problem if you go out. I don't know what are the local policies currently, whether you're allowed to go out or not. I don't know if you're allowed to go out. Yes, keep the 2 meter distance from other person.
But with children below the age of 12, like, isn't too hard for them to wear a mask or use the sanitizer so frequently? So,
Yes, I
like,
agree. Yes.
can we get more clarity on this thing? Is it really, really airborne? That's what
Um,
the people say, that the second mutant is more of airborne than the droplet borne thingy.
Well, I mean, I don't know the airborne. As I said, the still the studies are there, and people are still looking into it. Whether it is, I cannot just give my opinion without much
Concrete evidence.
evidence. Yes, the COVID-19 is less severe in the children, and most of the children are usually asymptomatic. It's difficult to wear the mask under the age of 12 years. The only thing is you prevent as much as is possible, like avoid the crowded places, avoid the um, clean, keep your hands clean, and that's it. Is the schools are still closed or open?
In India, they're closed. They're doing online classes and all. So it's more of online classes
As,
and online media exposure.
yeah, as I said, this affected every sector of the community, including the children, not only the health, economically, socially, emotional well-being. Yes, it has taken a big toll on the
So it's
society.
taken a mental toll on most of us, and then there's physical issues also that people have been facing. The people who have had this issue, this corona exposure, or people who've lost their loved ones to this disease,
Agree.
unfortunately. Being the ICU specialist, or what we call as insensitivist, uh,
Yeah.
like, people, the word ICU, it kind of gives me shivers to think about somebody being in ICU. So you see people coming in every day, almost, like, there are so many episodes of corona happening in UK, all over India, and more other countries. How critical are the patients that are being sent to the ICU? I mean, their rate of recovery, if we talk about that, what do you rate their rate of recovery? If they're on the ventilator, how much is the chance of recovery, or unfortunately they don't make up?
Yeah. If they are on the ventilator,
Mm.
invasive ventilator, like artificial breathing machine, where we put them to sleep, like artificial coma, the chance of survival is very, 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 very less.
Mm-hmm.
um, the mortality in this group of patients who are on the mechanical artificial ventilation is more than 90%, because they develop severe lung infections, they develop clot in their lungs, they develop multi-organ failures, they need not only supporting their lungs, they need supporting their kidneys by hemodialysis. They develop, the lot of our patients even develop stroke when they wake up, so when they woke up. So it is the chances of surviving is very less, if you are,
Yeah,
if you develop
that's one
multi-organ
thing that
failure.
we've noticed with corona patients, that most of them, when they've been in the ICU with invasive ventilation or not, they make up, they turn negative, and like 2 days after survival, they're no more. Why does that happen? I mean, because of the steroid invasion, I mean, because of the medication, or maybe because of other comorbidities, or what exactly could be the cause? Because this question, like, most of the people around us, they say that अभी तो वो पॉजिटिव से नेगेटिव हो गया तो खुश हो गए, एंड 2 दिन के बाद पता चलता है कि नहीं, it
The
didn't make any sense to them.
if you understand, I mean, it is beyond the scope of this one anyway. If you see the coronavirus, the deaths due to the coronavirus is not because of the virus, it's because of the other problems. It's because of the how body respond to your the coronavirus, you know. The
Mm,
when the body mount responds to the virus, it not only destroy the virus, it also start destroying your own lungs and your whole body. That's where it is the severe illness. And it doesn't matter if you're negative, it doesn't matter if you're negative, it's already you now after 2 weeks, after 4 weeks, after 5 weeks, we are dealing with the sequel of the coronavirus, not with the coronavirus. We're dealing with the multi-organ failure, and there's no after 14 or 15 days, there is no point in of doing the test, because even the test may keep coming positive even if you have a dead fragments of the viruses. So
mhm.
after 2 weeks of the infection, we are dealing with the complications of the COVID-19. So the patient died not because of the positive or negativity of the test; they died because of the other complications.
So we need to look at the underlying causes. We need to be very careful about what other ailments we might be suffering from. Okay.
Yes.
Before we wrap up the show, and as you had already mentioned, you are on an emergency call also. One question, since we were talking about the children, a parent has asked, how safe is the screen exposure to children? Like, how long can they be given this screen exposure? Because initially they would say like 1 hour screen time is good enough. Otherwise, they'll damage their eyes, they'll damage their mental health and well-being. But right now, when we talk about online classes and they have their exams and they have so many more things to do, activities through online medium, how safe is that? And if there can be an alternative, the parents can change some things about what is happening. If you could enlighten us on that.
Well, no, I go through the same problem. I don't have answer for this one. My kids spend most time on the TV and then the online. Well, yes, less is the better. Just use whatever necessary. The online classes
Mm-hmm.
are necessary, yes, whatever necessary. And allow them to play outside. If you have a garden, yes, allow them to play outside and involve with the kids in home, play some other games like board games. And it is the right time to develop a good family bond, because we're all at home, and so we can develop some family values in the children, involve them in the house works. I'm sure a lot of the domestic helps are also isolating themselves at home, so we have less domestic help at home, so use them.
Right.
And
Thank you.
it's a difficult time. There's nothing right and wrong answer for this.
We are all going through the trials and tribulations of time, and we are all making our
Yes.
own efforts to find out what is right and what is not right.
Yeah, that's
So
agree.
that
Yeah,
thank you so much for giving us your precious time,
yeah,
and
sure,
hope we
sure.
will have you again with us on board, and we'll be enlightened with some more subjects or questions and queries that people might have with regard to different ailments, since you
Yes.
are associated with us. Thank you so much for joining us on RNA. Allah Hafiz. ख़वातीन हज़रात, आप लोगों का भी बहुत बहुत शुक्रिया कि आप लोगों ने हमारे साथ इस प्रोग्राम में जुड़े और आप लोगों ने अपने सवालात भेजे। उम्मीद है कि हमने आपके सब सवालों के जवाब अच्छे से दिए होंगे। अगर कोई सवाल चूक गया है तो हम दोबारा से आप हम लोगों को बता सकते हैं। आप अपने कमेंट्स जो हैं हमारे RNA न्यूज़ का फेसबुक पेज है, उस पे जाके उसको लाइक सब्सक्राइब करिए, या हमारा जो यूट्यूब चैनल है RNA न्यूज़, उसको भी सब्सक्राइब लाइक करिए। डोंट फॉरगेट टू प्रेस द बेल आइकन, और वहां पे भी आप अपने कमेंट्स मेंशन कर सकते हैं। हम कोशिश करेंगे कि जो भी हमारे साथ नेक्स्ट डॉक्टर एसोसिएटेड होगा हेल्थ लाउंज में, उसके नेक्स्ट एपिसोड में हम आपके सब सवालों के जवाब देने की पूरी कोशिश करेंगे। अभी तक के लिए इतना ही, इजाजत दीजिए। अल्लाह हाफिज। इल्तमास